Fear of impotence, anxiety, guilt, or depression after sex. Ever had excessive sexual dreams? You guessed it, soric. And don't forget premature ejaculation. Sycotic cranks up the heat with intense sexual desire, yet impotence. Craving more. Excessive sexual desire is also psychotic. Plus, watch out for warts and a history of gonorrhea. Aversion to sex, even repulsion. Painful coition? Orgasms from the slightest touch? Yep, syphilitic. Genital shrinkage or weakness.
Hello friends, welcome to Learn Homeopathy. Myself Dr. Ganapathy. We were discussing about the PQRS series where we have discussed initially the mental PQRS, physical PQRS. In the physical PQRS series we are discussing now with the sexual PQRS. So we have discussed some of the points in the initial part, and now we are going to tell you about the case where we have treated a hydrocele case with impotency. A patient of 45 years old came with a pain in the right testis with a swelling which was diagnosed as a hydrocele. Swelling was very hard with the impotency. The pain was severe and patient were unable to sit, and even the touch also used to a pain. And the patient's symptoms were considered where he had a alcoholic history and a history of craving for a meat and alcohol was there. History of sexual excess was there, and he was exposure was there, and followed by the warts and ointment application which was suppressed, and followed by a development of the impotency was there. So mentally he was later on, his mental was, thing was very dull, and guilt of sexual night, restlessness was there, anxiety was there. These are some of the mental symptoms were taken. So pathological symptoms was the hard nodular swelling on the scrotum, and that was diagnosed hydrocele. So repertization was done, and repertization we had taken a hydrocele, impotency, craving for alcohol and meat, and there was suppressed warts and pain in the right side of the testis. Repertization was done. Conium has the remedy has came, but the conium is a pathologically very right remedy, but whether you have to give at this point, no, because the sycotic miasm, the miasm has to be cleared. The miasm is that there is a warts were there which were suppressed, and the miasmatic layer was the first layer where we have to remove with the antipsychotic, anti-miasmatic remedy. That was we consider Medorrhinum as a medicine which was given in one impotency. Why it was given? Because of suppressed warts, sexual excess, alcohol desire, meat desire, and there is sexual indulgence was there, and impotence was there. Those are considering we are given initially months. After giving a 1 month of remedy, his symptoms were better and mind was stable, night guilt was better, and restlessness was better, and dullness was better, and pain mildly was around 20 to 30% pain was better, but the swelling was there. So considering the swelling, we have given a remedy which is a very pathologically correct remedy, conium 30 water dose was given for a 1 month, followed by SL for a 1 month. So this was given an improvement in terms of 20 to 30% of improvement was there. Patient was followed another 2-3 months with the increasing in the potency of a conium 200 weekly 3 days. This was given, and the patient was much better. Almost 70 to 80% of the pain were completely better. Swelling was reduced around 60%. Patient was happy and feeling better. His impotence was improved, and his performance was started. And later on we have at the end of around the 9th month we have increased the potency to 1 m for 3 doses were given for a 1 month. That time there was pain was absolutely better and swelling was completely better. So learning about the case is that there is a miasmatic clearance has to be done and pathological prescription to be given to clear the case. Simply giving a conium will not help you unless the miasm has been clear. So this learning we have to understand PQRS symptoms has to be understood. The sexual PQRS symptoms has to be considered, which will help to crack the case and treat the diseases, and 100% results you will get with the PQRS symptoms and layer wise layer treatment. Thank you. That's all.